We all know that there's been a stigma for hospital food for decades and years, but what's the current state of hospital food in your opinion?
Well, I mean, I don't think hospital food opinions have changed much. I think when you think of hospital food, most people, nothing like sustainable and fresh, local comes to mind. I think, people feel hospital food is honestly a punishment sometimes, but it's ironic because hospital food is actually the first opportunity that we have to use food as medicine. And I think it's incredibly important that we serve the right kind of food for healing the patients.
Right. And there's been a big push to that recently too, just really kind of focusing that as like food is medicine and making the patient understand that. Like in order for you to get better and get out of this hospital, you need to eat good, healthy food.
Yeah, absolutely.
And do you see that at your
Yes, I think, we've really seen that evolution of food and healthcare, whether it's aligning with population health, making sure that what we preach is what we are serving to patients.
right.
But we're also seeing kind of different pillars. So looking at more local sustainable food, supporting local farmers, really making sure that, we spend a lot of money on food, making sure we're trying to put those dollars into our communities, but then also looking outside of the four walls of the hospital
Right.
and looking at food insecurity, medically tailored meals, and really changing the conversation. It's not just about serving food in the cafeteria or in the patient room now. It's really going beyond that and evolving to healthy, truly healthy hospitals.
Yeah. He mentioned communities and giving back to the community and
Right.
really sourcing locally. What does that do for a community? I mean, first of all, a hospital is part of the community, right? I mean, that's everybody's like safe space. Like the hospital's right on the corner. Everybody, you go into a community, everybody can tell you right away how to get to the hospital because they all just know that's part of the community. But what does it mean when that community, that hospital then starts giving back to the community by buying local food and things like that? What do you see from that?
Right. Well, just like Kyle mentioned, food is more than just the experience of eating food.
Right.
We have a lot of opportunity to drive power with purchasing, to help support local communities, even to support small and local business owners to create an environment where an economy can flourish.
Right.
Just because of what the hospital pours into as far as purchasing goes. Even supporting local farm economies, I think that's really important. But it's not just about purchasing and economies. I mean, that is extremely important.
Right.
But also the benefit to the patient and to the person that we're serving the food to. It's fresher, it's better for you,
Makes sense, right.
nutrients at the peak of ripeness. It's really the right thing.
Yeah. And do you see that as well as like from the patients when they know they're getting served strawberries or whatever it might be that literally were just grown a couple miles away? How does that play an impact on them?
I think with most of our patients when they're in our hospital, food is the one thing they know and understand.
Sure. Right.
And, just with anything, you want to know where your food comes from. I think that's something that's changed. Whereas in the past, you get just a little box lunch or your food travels from around the world. But now when it's coming from farms that in some cases, because they're in your community, you
Right.
live in those communities.
Right.
It's something that really, is a little bit of comfort to the patient.
Right, Jersey tomatoes, right?
Garden State.
Garden State. That's it. Why is the food philosophy so important for for what we do at Compass One and then with like Meridian Health, like having that same philosophy, being on the same page? Expand upon that a little bit for me.
Yeah. When we have hospitals that get started, that's the first question. How do we get started? What do we do? And the food philosophy actually is the first opportunity for a hospital to decide what do they want to stand for. And I think when you say, I want to stand for having the healthiest people or the healthiest staff, that starts with healthy food. Or I want to have the most sustainable food service. So
Right.
a food philosophy really defines what a hospital stands for. But it also is an opportunity to be different from other hospitals. It brings a little bit of a competitive edge.
Mhm.
And also it can be a way that a hospital brands itself through how they approach food and how they promote healing. Everybody eats. And so it's an opportunity to be a differentiator.
Yeah, for sure. Do you feel the same thing as far as the philosophy this philosophy that you guys wanted? Is it in tune with what Morrison brings to the table? And that, is it how's that partnership really enrich your hospital?
So I think, you mentioned the keyword partnership, and how we've been able to truly excel with our program has been in partnership with Morrison, because it's something that, any change in healthcare, you can't do it alone,
Right.
or you fail. And in this case, we had a lot of alignment, and then, we have a relationship in that if there was something out of alignment, we just addressed it, and boom, it
Yeah.
excelled, 1,000 times better than what we even had planned. So, I think food, as you mentioned in the beginning, food is medicine. At the end of the day, hospitals are about health, and
Yeah.
about, and we're seeing that evolution towards prevention, and it's pretty simple, in terms of philosophy, and just moving in that direction.
And one of the biggest things in that philosophy too is sustainability. Expand
Yes.
upon that a little bit for me, Lisa. I know that's kind of your sweet spot.
Yeah, yeah. So, we talked a little bit about local, the impact of local. That creates a more sustainable food shed. Also, the way we source food. So, do we have growth hormones in the milk? Are we making sure that we're sourcing dairy that is pure, or are we sourcing seafood that's sustainable? Are we operating in a sustainable way?
Mhm.
So, reducing food waste, making sure that our operation runs smoothly and is mindful about what we're putting into the landfill, how we're impacting climate, greenhouse gas emissions. That all comes from food. I mean, we have a
Right.
lot of power to make change, and I think sustainability is really important. I think something that Kyle said is we have a lot of experience as a company, but it's only experience. The experience only goes as far as the partnership. So that's where you really get that ability to make change and to be different is combining the experience that we have with collaboration in a deep partnership and understanding the goals and moving towards those goals together. And I think that's something that we would both agree upon, and as far as what we do for Hackensack Meridian Health is trying to move into a more sustainable food service operation.
Yeah.
So
Kyle, your thoughts on sustainability and how it plays a role?
So, three of the basic pillars of health: healthy air, clean water, healthy soil. And as we've, looked upon sustainability, our hospital's only going to be as healthy as the environment that the hospitals are in. And that has to do with what we do within our four walls, but then also outside of it. And when you talk about food, it's not only the food that we're serving to the patients, but, how is that food produced? And
Right.
I think that what's been so beneficial, and I don't want to say easy because none of this work has been easy,
it's not easy.
Yeah.
has been around, aligning it with our strategic priorities, and sustainability and health one and the same. So antibiotic-free meat, antibiotic resistance, obviously it's a huge
Sure.
issue
Sure.
globally. Getting antibiotics out of meat, when we were talking, I don't know what the statistics are today, but back then I think 80% of antibiotics in this country were going towards meat versus people. Of that, 70% was the same antibiotics that we were prescribing people.
Right.
And at the end of the day, we're focusing so much on eliminating antibiotic, or on reducing and only prescribing antibiotics when it's absolutely medically necessary. But when 80% is in the food we eat, I mean, that's stupid.
Right.
So that was something that we tackled then, and then other pieces, just health, why are we serving sugar sweetened beverages in the hospital? Why are we serving fried foods? And it's part of a journey forward, but it's something that it's in line with our mission, and every avenue in healthcare is going towards that, because the current costs and all that is unsustainable.
Yeah, for sure. Um, you mentioned the importance of diversity earlier. Why is that such an important part of the philosophy that we have?
Yeah. I think diversity is one of the biggest buzzwords in healthcare right now, and it's for a good reason. Um, if you're a hospital and you're not focusing on diversity, then we're not really functioning to our fullest capacity in bringing people together,
Mhm.
and also supporting equity. And that's one of the biggest things. So, I think about our food service operation. We have a large company. We purchase a lot of food.
Sure.
We have a lot of opportunity to make change with the dollars that we spend. So I feel like the responsibility for us is to use that to support producers of color. We can build health equity. We can build capacity and resiliency in the farmers network, in the food network.
Yeah.
There's a lot of small business owners that really could benefit and have so many different facets of food to bring to create a unique food service environment. Um, Food. I'm just going to talk about food for a second. So food, it's all about the deliciousness, right?
Right,
And
right.
so people come together, we celebrate around food. And food comes from all different regions, all different cultures.
Sure.
And I think when we talk about the importance of diversity, it's bringing all of these different regional cuisines together. And that brings inclusivity in a hospital environment. And it's just the right thing for people. So diversity can really bring people together in a hospital through celebration, food.
Yeah.
It's a really good opportunity.
Well said. And at Hackensack, I know you guys are focused on that as well. Talk to me a little bit about that.
Yeah, we need to be reflective of the communities that we serve. So when we talk about diversity, we have 18 hospitals throughout the state, and food is something that, with, all of the different groups of people that we're serving in our hospitals, we have to have cuisine that meets,
Sure.
their culture. And, when we look at on the supply side, when we partnered with the Common Market, that was something that we found this organization during COVID. We had actually partnered up with them to give out fresh boxes of local produce.
Okay.
During COVID, a lot of farms were getting hit pretty hard with businesses being shut down, schools being shut down. And we partnered with Common Market to distribute food in our vulnerable communities. Fast forward, they had a program that they had partnering up with producers of color. And during the off months of when school's out of session, some of these farmers, would have a lull in being
Okay.
able to find a end client for the food. So we worked with Morrison's, brought this group in, and now we're selling, I believe.
Oh gosh, everything: green beans, spinach, you name it. Geo greens, microgreens, from some really interesting
Cool.
farmers that FBI background decided to turn farming,
Right,
family
right.
farming. A lot of fun stories.
So yeah, I mean, it's just the diversity. I think it's interesting when you talk about diversity with food and the cultures with the food. I mean, people, it's not something most people would think about when you talk about diversity, but being able to try to appease all your clients and appease the people that come into the hospitals. And if I'm from a certain background and I see that my local heritage food might be served in the hospital, that makes me feel really good.
Yeah.
Right?
It
There's
does.
a huge impact there.
It does. And we're broadening our scope. The chefs have put together some really great menus coming up. We have some Filipino options that are coming up, which is kind of near and dear to me, my
Right.
culture. And we have Latin cuisine, Caribbean cuisine, lots of different varieties coming up. So a lot to look forward to.
Cool. My last question will kind of wrap this up. Kyle, if you wanted to go in to give other systems out there an idea of where to start, what are some of the elements of a successful program?
I think the first key is what you asked, starting. A lot of times folks wait and they try to find the perfect time or make sure that everything's together. And when you wait, nothing's going to happen.
Yeah, right.
You got to just get started. And I think for us, we were fortunate in that our CEO had come to us and he said, hey, is our retail food aligned with our population health program? And that really, so we had a big push from the C-suite in the beginning. But that being said, we started antibiotic resistance. That was it still remains a huge topic.
Sure, of course.
We jumped on that. It's all about finding champions and aligning the components of the program and really making sure that you have some solid senior leaders on board and supporting it, but just being flexible and jumping on opportunities as they arise.
Nice. Lisa, same question for you.
Yeah, so I'm going to walk us back through collaboration.
Yeah.
Having a great partner, bringing experience to the partnership from our organization, working to build off a vision. I think that's what's been so beneficial with working with Kyle is that he had a vision that we were able to really understand and support. create the food philosophy, build the food philosophy, decide what you stand for, and then bring in the right tools. That's where we come in, to bring in the right tools, such as, do we want food pantries? Do we want a farmer's market? Do we
Sure.
want teaching kitchens that engage the community or
Right.
educate staff? So bring in all the right tools to kind of make it come to life.
I think what it sounds like too is that it continues. Once you establish your philosophy, you have to be flexible too. You have to continue to evolve it. Correct? I mean, things change in life. I mean, we went through COVID. Nobody saw that coming. We had to change some of it. But being able to be nimble and flexible is a big role. Is that correct to say?
Yeah, absolutely. Absolutely. I think that's where collaboration and communication comes into play. And honestly, things change so quickly. Even the food service environment has changed, and we've changed our approach many times to make things happen. So I think having the right partnership, the right plan in place, and keeping some of the basic tools, combining it with our ability to execute, it all works out.
Good stuff. Thank you both very much for your time today. It was a pleasure having you guys on the podcast, and continue great work, continue the partnership, and look forward to seeing what the future of hospital food is going to entail. Thank you very much.
Thank you.
Thanks, Tommy.
Thank you.